not discuss. I will come to you, inshallah. Wait for a second, inshallah. Okay. Okay. Goodbye. Assalamu alaikum. Assalamu alaikum.
Alaikum assalam. Walaikum assalam wa rahmatullah.
You are very lucky. You're when you call me, there must be some patience. Okay. Are you allowed to come now to the hospital or not yet?
Not yet.
Not yet.
Okay, that's fine. Let us start by al-Kitab. بسم الله الرحمن الرحيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك Okay, let's go for your long case presentation. I hope we can finish within 1 hour as we planned.
Okay, inshallah.
Okay.
Okay, so we will start with the role play first.
Okay, please, every part will take about 15 minutes, not more.
Okay,
Inshallah.
Okay.
I'll begin, Doctor.
Sorry?
I'll begin.
Yes, you are welcome. You are Butri. Okay.
Yes, ma'am.
Okay, Aslan.
Assalamualaikum, Doctor, and everyone here today. So for the case 2 presentation is about infectious diseases. Our members are me, Putri Sofia, Izzah Zahira, Afika Atira, and Nur Afika. So we begin with role playing by me, Putri Sofia, and Izzah Zahira. Izzah, are you there?
Yeah, yes, I'm here.
Begin. Assalamualaikum. Madam, I am Putri Sofia. I'm a third-year medical student in pediatric posting in charge of taking history from you today. Is that okay?
Oh, yes, it's okay. Walaikum salam wa rahmatullah.
Thank you. Is this your child? How old is she?
Yes, this is Carissa. She's 9 years old now.
Okay. So what brings you here today?
My child has been suffering from a really bad fever and she's been so tired for the past 4 days now.
I see. So how did you realize that she had a fever?
She was warm upon touch.
Did you give her anything to reduce the fever at all?
I tried to relieve the fever by using a tablet sponge and giving her paracetamol, but she can't tolerate much. She's able to take out the medication, but she vomited it out after.
Did her fever go down at all in those 4 days?
No, the fever was persistent.
Did she shiver, and was it accompanied by any rise in temperature?
Yes, sometimes she has chills and rigor.
Is there any food allergy or allergic to any medication?
None that I was aware of.
I see. About the vomit, how many times does she vomit and when did it start?
It started on the first day. We realized that she was unwell. She vomited about 5 times that day.
Oh, what was inside what's the contents of the vomit?
She vomited out some food particles and chunks of the paracetamol tablet.
I see. What color was the vomit? Was it green, yellow? Did you see any blood?
I didn't think there was any blood in the vomit. The vomit seems to be mostly of the food particles.
Okay, I see. Is there any other symptoms?
Well, the vomiting was followed by coughing. The vomiting was pretty bad. She complains of stomach ache sometimes. She also complains of intense headache.
Oh, what was the characteristic of the cough?
It was kind of chesty in nature.
Does it have any sputum?
No.
Was the cough associated with any sounds or breathing problems?
No.
Okay. Was the stomach ache on and off, or was it just continuous?
She complained to me that it was intermittent, but these symptoms only appear on the first day. So we went to the nearest clinic on that day, which was Klinik Kesihatan Bersera.
Oh, I see. What did the doctor do in the clinic? Did they mention anything?
They took a blood sample for investigation and gave paracetamol, but still the fever was not resolved. Her temperature at that time was 39 degrees Celsius. So after 3 days, when I saw that her condition was worsening, I went back to Klinik Kesihatan and then they did some more tests and referred my child here to HTA.
Okay. Does she have any normal bowel movements?
Apart from the stomach ache, everything was okay.
Okay. You mentioned that she has been so tired.
Yes, she's usually a very active girl, but the last few days, she seems so tired that she just lies in bed and sleeps almost throughout the day.
I see. Is she a picky eater? Does she eat and drink normally?
Yes, she is. She doesn't like her vegetables. Normally, she eats adult food, but it doesn't matter now because she seems to have a lot of appetite. I think that maybe because she fears that she might vomit after. Sometimes she doesn't finish her meal and doesn't even want to eat at all.
Oh, I see. Okay. How was her appearance? Anything off?
Well, I noticed that her eyes were sunken and her lips and skin was also dry.
Oh, does she urinate normally?
She urinates less often nowadays.
What color was the urine? Was there any blood in it?
There wasn't any reddish hue, so I don't think there's blood in it, but it was dark yellow.
Oh, was the urine frothy or was it painful to urinate?
No.
Is it painful to urinate?
No, it's not painful for her.
Okay.
I think so. She does.
Uh, did you notice any weight loss at all?
I'm not sure.
It's okay. Is your child complaining of any night sweats,
No.
joint pain,
No.
muscle pain?
No.
Okay. Any discoloration on the skin,
No.
rashes?
No too.
Okay. Did she had a normal birth or was there any complications at all?
She had a normal birth and there wasn't any complications.
I see. What about her growth?
It was normal, nothing significant, doesn't seem to have any problem before, and this is actually the first time that she has been hospitalized.
Oh, okay. How may I ask about how many siblings does she have?
She's the oldest and has two other baby brothers.
Oh, okay. Do you and your husband have any medical conditions?
No, we are very healthy.
Okay. What do you and your husband do?
I'm a hotel staff myself, and my husband is a train driver.
Okay. May I ask, do you smoke? Or what about your husband?
No, we don't.
Okay, that's good. Does your family have any history of similar symptoms like Carissa recently?
A week ago, my son and my husband had the same kind of problem, and they were diagnosed with dengue fever at the clinic, but they were not warded on anything.
Oh, I see. Where do you live? Is your area common for dengue?
We live at Jalan Besara, and it is a dengue-prone area. They had actually been fogging down recently.
I see. Does your home have any stagnant water, like a flower pot laying around somewhere for mosquitoes to breed?
No, we don't.
Any rodent infestation?
No.
Have you traveled anywhere outdoors, maybe jungle trekking or have water sports?
No, no traveling.
Oh, I see. Maybe because of COVID. Okay. Do you have access to basic amenities?
Yes, we do.
Okay, that's good. Does your child follow the immunization program?
Yes, we follow it routinely.
Okay. Was she breastfed?
Yes, she was breastfed up to 7 months old and then continued with formula milk. She started weaning at 6 months old, I think.
Oh, okay. Good. Can she do daily routines on her own or does she need any of your help?
Oh, yes, she can at home. She managed to do self-care activities like eating, bathing, and wearing clothes all on her own.
I see. What about school? Does she go to school?
She does,
How is
and
it?
she is
Oh, okay.
very smart, active, and has lots of friends.
Okay. I think that's all. Is there anything else you'd like to mention?
No, I think that will be all.
Oh, okay. Thank you for your time, Madam Iza. Later, I would like to do an further examination on Carissa to know more details about her condition.
Okay,
Okay, thank you.
thank you.
Okay, for my patient, Bismillahirrahmanirrahim. So for the chief complaint, Carissa, a 9-year-old Malay girl, presented to the emergency department of Hospital Tunku Ampuan Afzan HDAA due to high-grade fever and lethargy for 4 days duration. She was apparently well until she had unresolved fever for 4 days ago prior to admission. The fever was sudden onset, associated with chills and rigor. It was not resolved by paracetamol, and she was unable to eat the PCM tablets. The fever was persistent throughout the 4 days without any pattern at all. On the first day she got the fever, she had 5 episodes of vomiting preceded by cough, and it contains food particles and the PCM tablets. There was no blood and bile content. She also complains of abdominal pain due to frequent vomiting, and it was intermittent in nature. She complained of headache, but unsure of the localized site, and this appeared on the first day of the illness. Her mother took her to the nearest clinic kesihatan on the first day of illness, and they took a blood sample for investigation and gave her PCM tablet, but the fever was not resolved. So the temperature recorded at the time was 39 degrees Celsius. Due to worsening condition and abnormal blood findings, the general practitioner referred her to the emergency department of HDAA on day 4 illness. Besides that, she appeared lethargic as she was unable to go to school and only lie in bed, as well as slept throughout the day. She had reduced oral intake due to fear of vomiting and unable to finish her meal and refused to eat. Her frequency of urination also reduced and is concentrated. Her mother noticed sunken eyes, dry lips, and skin, and claimed that her son and husband also had fever a week before patient had, and diagnosed as dengue fever, but by the blood investigation at the clinic kesihatan, but was not warded. They claim they live in a prone dengue area and fogging activity was held recently. So for the systemic review of the patient, generally she has fever, headache, reduced oral intake, and is lethargic. On respiratory, she has a chesty cough. For gastrointestinal, she has vomiting and abdominal pain. For genitourinary, she had reduced urine output and it was concentrated. For ENT, ear, nose, and throat, she has a sore throat. So past medical, this is the first hospitalization. For birth history, everything was normal, spontaneous vaginal delivery with no complication. For nutritional history, it was also normal, but she had loss of appetite recently. For growth history, the growth is suitable with her age, and there's no problems at all during her childhood. For developmental history, it was normal. Immunization history, she follows the immunization schedule regularly. For drug history, she's unable and having difficulty consume PCM tablet and vomit the drug after a few minutes consumed. For family history, she's the first daughter of 3 siblings. Her last brother and father showed similar symptoms of fever and lethargy as she had passed a week before, and it was resolved. They were diagnosed by positive dengue. Her mother and father has no non-medical illness and are not smokers. Here's the family chart. Next is the social history. They live in the dengue endemic area, and fogging activity was done recently. Otherwise, they denied any travel history, rodent infestation, or stagnant water. So we move on with the physical examination. For the general, positive findings for the general is that she is stable, conscious. Alert to time and place. For the positive findings, she has occasional cough for a few times, which is chesty in nature. There is dry lip but no sunken eyes noted, which is a sign of dehydration. There is a branula on the right dorsum of the hand with active infusion of normal saline. She has a whitish coated tongue and her throat is injected but not enlarged. For the peripheral examination, everything was normal. Inspection of the face also normal. For the vital signs, her blood pressure is 90/58 millimeter mercury, which is normal. Her pulse rate is 66 beats per minute, which is good volume and regular rhythm. Respiratory rate is 24 breaths per minute. She has a fever of temperature 38.4 degrees Celsius, which is a high-grade fever. Normal oxygen saturation. And for anthropometric measurement, her height is 126 centimeter, weight of 21 kg. Her BMI is 31.2. For the systemic examination, cardiovascular and respiratory examination were all normal. For abdominal examination, on palpation, her abdomen is soft and non-tender except at the epigastric region, but there is no guarding. Otherwise, it's normal. For her central nervous system and musculoskeletal system, they're both normal. They're all negative findings. That's all from me.
Okay, stop now. We are examining you now, Butri. Thank you, but you are very, very hurry, both of you. I mean to consider the time not to be hurry.
Oh, sorry, doctor. I apologize.
If you are going to, no, I'm speaking to you. If you are going to speak to any patient, you must be patient. I mean, you must be sympathize, tell them a good introduction and so sorry and like that, because whatever the patient, he needs someone to just be smooth with him. Okay, so it is very important to take care about that. You didn't touch the headache by any way. Why?
Because it was not localized in where.
Did you suspect that 10-year are able to localize or not localize? Did you ask about the characteristic? When it occur, what is the characteristic? Is it retroorbital? Because what's your diagnosis?
Dengue fever, but Isa mentioned that she complains of intense headache, so I thought it was intense headache.
It is very important. Yeah. Why it is very important? What is the characteristic of headache in dengue?
Due to the plasma leakage, if I'm not mistaken.
Sorry?
Can you hear me?
Yes, you increase your voice, please.
Due to the plasma leakage.
No, I mean what is the characteristic of headache?
It could be localized, it could be generalized, but for this patient, it's intense headache.
Usually they are complaining of retroorbital, can be complaining of retroorbital headache.
Oh, eye pain.
It is very important. Did you ask about any relation with the headache and the vomiting, any timing of headache?
No.
Okay, can you see now that you put the CNS symptom examination, you comment about everything, but you didn't touch an important negative findings, which is?
The headache, is it, doctor? The eye pain?
Who can answer? Someone has a severe headache, even if he has a viral infection like dengue, and he has upset in the abdomen, liability to vomit or abdominal pain and like that. So we must rule out any
warning signs.
Yes, any meningitis or encephalitis. Because sometimes we do see many patients with dengue encephalitis, like any virus. So you must do Kernig's and Brodzinski signs, and you must comment about that. Make it as a habit. If any patient has fever, if any patient has headache, if any patient has upset with that, you must do this Kernig's and Brodzinski to rule out if this virus already go to the blood and cause viremia, and this viremia can affect the either meningeal or encephalitis, okay, or both meningoencephalitis. The other thing you said that the normal growth and development. What is the weight of the child?
The weight of the child.
Yeah. Did you put this vital sign in centile chart?
No.
Why? How can we say it is normal or abnormal without put it in centile chart?
I didn't mention it was normal. I just stated it that it was height and weight, but I think
you mentioned it twice.
Yeah.
So what is the normal weight for 10 years old? Anyone knows the formula? It is inside your pediatric protocol.
It's age in years plus 4 and times 3.
Sorry?
9.
Who can tell us the formula for calculating the weight of 10 years?
26 kg, doctor.
You told me that it is age multiplied by?
Age plus 4 and then in brackets times by 2. That's what I
So-
saw in pediatric protocol.
Good. So it will be how much now?
26 kg.
26. So it's 21.
Yeah.
Okay. So it is very important because our responsibility for the patient came to us in our clinic or in our follow-up, okay, to make sure about his centile chart. We may pick him early developmental delay or early gross impairment, okay? So we must put him in centile chart. And even now we recommend the measuring of the blood pressure even from the 4th year. And some said from 3rd year. It is very important, okay? So what's your diagnosis now, Butri?
I believe that it's dengue fever because there's presence of warning signs. She has a family history of her brother as well as her father has dengue fever recently, about a week ago. They live in a dengue-prone area. Her warning signs is of fever followed by abdominal pain. There was vomiting, and also dehydration. She has dehydration signs.
Okay, so is it your diagnosis now is only dengue? Because dengue is
There-
not, has many types of dengue. We have simple dengue, we have,
A dengue with warning signs.
this is dengue with warning sign. So better now we are in 5th year, so you must be able to tell us the complete diagnosis. Is it dengue with warning sign or did you suspect after getting the pulse rate? Also for me, it is a bit strange. 66 with a patient with fever. Hmm? Usually, if the child has got fever, usually his pulse rate will be increased. But whatever his blood pressure is not low, so you already excluded dengue shock or dengue hemorrhagic case. Okay, so you must be able to say, is it just simple dengue or complicated one? Either it is warning sign, either it is shock, is it is hemorrhagic, which is very important. What other test you must ask yourself to do now during your clinical examination?
Investigation.
No, before investigation.
Tourniquet
It is a
test.
clinic, yes. Why you didn't include it? It is very important.
Actually, that will be included in the next presenter's slides.
Yes, I know, but now she is the one who is examined today. She must be able to say, I'm going to present tourniquet test because even some negative signs are considered positive. Okay? She must be
Doctor,
able. Mm.
is tourniquet test part of lab investigation or is it just by bedside? You just
Bedside.
Yeah, it is
right.
bedside.
Okay,
It is
okay.
bedside.
Bedside.
And it is very important. Sometimes we are not in need to wait to send the blood and get the result from the lab, which may take some time. If the patient has bleeding tendency, we need to intervene a bit early.
Thank you,
Okay,
doctor.
so how can you confirm now, Butri, the diagnosis of dengue?
Without the lab investigation, is it, doctor?
No. Okay, you examined the clinically now. What investigation you are going to consider?
NS1 antigen.
Why?
And to detect antigen for dengue, and as well as a full blood count to check for hematocrit, liver liver function test to check for liver for abnormal readings for the liver to see, because that is one of the warning signs. We can also check for the full blood count again, besides hematocrit, for the check if there is leukopenia, if there's a less white blood cell count, because they could present with thrombocytopenia due to the plasma leakage. And after that, renal profile as well, because she mentioned that her daughter has decreased urine output. So we want to see the renal profile to see if the renal function and electrolyte balance is suggestive of dehydration and if there's any complication in kidney injury, because she also said that all of the positive findings generally leads to dehydration.
Okay, so when you are using the test for dengue, I mean, when you are going to do IgG or IgM or other test for dengue,
When is it?
yeah, what time? Is there any difference in your indications? I have now 3 facilities, NH1, NS1, and the IgG and the IgM. What is the timing for them?
On day 4, is it, doctor?
All of them in day 4? No issue. Now we are under learning. If you don't know, said I don't know. No issue for that.
Okay.
Who can answer?
You mean the duration where we can detect the antigen antibody in the blood, is it?
Which is the same, which equal to the same when I am going to do the test.
When there is a epidemiology exposure, so then we observe the clinical symptoms consistent with dengue symptoms. That's when we directly do the dengue combo test to detect the dengue virus antigen, which is NS1, and IgM and IgG may appear a bit later. So if it's not like the test will become directly positive, the NS1 will sorry, I did. Can you
anyone is not using the mic, turn it off, please.
Okay, so the NS1 we can detect as early as the onset of symptoms. Meanwhile, the IgM and IgG may appear a bit later.
What later? Anyone has a sharp answer?
Actually, I have the graph showing the presence of NS1, IgM, and IgG in my slides later. But for the specific dates, I think it doesn't show the specific day.
No, my sons and daughter. It's just a few months. You will be included in the care of the patient. You must know our most common diseases. You must know it from A to Z. We don't excuse anything like that. Okay, we are not waiting for the slide now. We are speaking for 5th year for a most common disease. Okay, let's come back to Butri.
Yes, doctor.
What is the management of the dengue now?
Symptomatically, you have to treat it symptomatically. It's very important for fluid. What's that word again? Resuscitation of fluid. Sorry, doctor. Like replacing the fluid due to the dehydration, as well as we start with airway breathing circulation and then fluid replacement. We give normal saline, especially in this patient because she has a lot of findings for dehydration, a dry lip, sunken eyes. And then after that, make sure to check the hematocrit. If it's very low, we need to replace the blood and then check for the liver function as well as the renal profile. And continuous management between the vital signs as well as the fluid therapy so that we don't overload the patient with too much fluid. So basically it's symptomatic treatment for the patient.
Yeah. Symptomatic treatment, and the very important word which you said is judicious use of the fluids.
Yeah.
As you said, it is very dangerous to leave the patient dehydrated, and also it is not advised to overload by the fluid. So we are going to check. So the most important point for the management is frequent monitoring. Usually any patient admitted with this warning sign must put a sharp guidance that this baby need to be followed like hourly vital signs, okay, like that, and you are making him close management, okay, because it is very important. It can, the patient can easily changing from the issue of just dengue with warning sign, and you can find him now go for a shock if you didn't expect. Also, I may ask someone else, where is your attendance? Where is the boys today? Adib, Adib, Irshad.
Yes, Doctor, I'm here.
How are you? Where are you studying today?
I can't turn on my microphone. It's too noisy here. Sorry.
Okay, so what did you suspect if the patient started to get hypotension and is going for shock? What is going with his blood pressure? Can you hear me, Adib?
Everyone else can hear you, doctor. I'm not sure about him.
Okay.
Doctor, I disconnected my my earphone. Sorry.
Okay. Did you
Okay.
hear me before or not?
No, I didn't.
If the patient started to get hypotension, what is the sequence of decreasing in the blood pressure?
Patient develop hypotension.
Yes. Everyone turn his microphone off, please.
I think my microphone is the one that's been
Is it the one?
noisy.
Okay.
Yeah.
So
Sorry,
who
Doctor.
can answer other than Adib? Okay, so you must go and revise what will happen for the blood pressure. It will drop suddenly or it will drop gradually. What is will start to decrease first? It is the systole or the diastole. What is going? And you need to answer me in WhatsApp message, please.
Doctor, can I ask, does it drop like suddenly when it enters critical phase? Is that what it means by your question?
Usually there is some sequences. That's why I asked you to go through and revise and tell me what is the sequence between the systole, between the diastole, between the pulse pressure. How is the issue going, which can lead, as you said, it can be the patient to go for shock very rapid. Okay, but that is the issue, because number one is the close monitoring and judicious management of the fluids. Okay, it is very, very, very important. If you did these two, then you can save the life of the patient of dengue, which is suppose, بإذن we can get zero mortality if we are very alert.
Doctor, can I just try and reconfirm with you based on my readings? First, we will observe the systolic will be normal, and the diastolic will drop. But later, when it progress, the systolic also will drop. Right.
No, just revise and tell me again. No.
Okay.
You need some modification, and you need also to add the relation at that point with the blood pressure, with the pulse rate and the pulse volume. Okay. It is very important. Do you know that it may be, I need to ask another candidate, how many types of shock do we have other than the cause? I know that by the cause, we have about 5 types of shock, yes? But if you ask the Zakwan now, shock can be divided into two types, which is compensated and
decompensated.
So what is the difference?
The basically is the progressiveness of the shock. Is the at the first stage the patient will come with the compensated, and then it will progress to decompensated. We can differentiate this through the capillary refill time, which is the compensated. We have it may still be sorry. Sorry. We can differentiate this using okay, if I can check for a while.
The number one inside this one, this slide in front of you now, the vital sign. That's why 100 times I told you that the vital signs are vital. Again, the vital signs are vital. You mustn't underestimate, you mustn't underuse this case, this vital sign. The blood pressure, what will happen if it started to be dropped? So now you are turned to
We're dealing with
decompensated.
yeah.
At the same time, you will find the pulse pressure increasing also. And at the same time, it may be the child started to get cosmal breathing due to metabolic acidosis like that. But the issue here is that child started to go for decompensated shock, mainly by the low blood pressure. Do you know what is the meaning of uncompensated? Another word, it is irreversible shock. Do you know what is the meaning of irreversible? You cannot now correct it. That's why this is the tricky point to do your job honestly in front of Allah and in front of the patient, or just ignore it. Okay, if the patient turned to be hypotensive, sometimes it can be irreversible and the patient to go for multi-organ failure and die. So again, Butri, the gold standard is the close monitoring and admit the patient under the required assessment if under with severe warning sign, it has its level of care. If it is with shock or with bleeding, he must change it for high dependency or ICU just for close observation. Okay. Okay, you can continue now your slides. I hope you can get the message and you need to answer my points, please. What is the going between the issue of the patient now is stable until he became irreversible. Okay, continue with presentation.
Okay, so next I will continue with the more of theory of dengue virus infection. So we will look at the phases of dengue infection, the clinical manifestation, differential diagnosis, and also to diagnose dengue virus infection, what are the components that we need to look at. So wait for a while, I want to share the screen.
Doctor, can I ask?
Yes.
You wanted the answer about the, basically we have to find the answer on the IgG, IgM, NS1 antigen, is it, doctor? And also the compensated and decompensated shock?
Yes.
Those two, okay.
And no, also the differential diagnosis, because we may not find time.
Okay.
Are you presenting differential diagnosis or not in your slides?
Yes. But
Let's see if we need to add more details or not. Okay.
Okay. Thank you, doctor.
Welcome. Okay. Go ahead.
Oh, sorry. Okay, now can you see me, the screen, and hear me?
Yes.
Okay. Okay, now we are going to go deeper. This is more theoretical and Then we will discuss further about this case. Okay, first, what we need to take note is when the patient comes with, like Putri said, it fulfill the epidemiology exposure, meaning the area is a prone dengue area, and then the patient come with typical symptoms of dengue infection. So we need the next thing is that we need uh, to be able to tell which phases is the patient fit in, because dengue we have a few phases which is important. Later we will go deeper after this. So unlike adult, children usually they present with asymptomatic and also minimally symptomatic, meaning that not all children will be present with typical symptoms of dengue, unlike adult. So maybe they will just present with high fever, and then there is no other typical symptom of dengue. But when there is a epidemiology exposure and we suspect the patient to have dengue virus infection, and also include like our patient, the family member also recently diagnosed with dengue. So we need to suspect dengue as the diagnosis. So a bit about the theory of dengue virus infection.
But
The
don't
incubation
prolong it, please. You have limited time. Okay.
Oh, okay. Just to mention, the incubation period is from the day the mosquito bite. So it will take about 3 to 2 weeks. So this is important in history taking. So that's why we need to ask the patient when he comes with fever and then symptoms of dengue. For the past 2 weeks, is he exposed to a dengue prone area, or realize that she's been bitten by mosquito? So this is important in history taking. So the phases includes febrile phase, critical phase, and recovery phase. Remember that not all patient will have critical phase. Maybe the patient can comes with febrile phase and then directly to recovery phase. Most of the patient, the infection will be self-limiting and mild. So that's why I explained the family members just now. They have diagnosed with dengue fever, but then that does not need to be admitted to the ward because it is self-limiting and they resolve spontaneously. So the dengue with the warning signs, which is mild and self-limiting. Dengue with warning signs, we need to be able to recognize the symptoms because we need to treat early and intervene to prevent the patient to progress to severe disease and severe dengue. So in febrile phase, this is most of the patient will present with when the patient comes to us. So first, he or she will have a sudden onset of fever and then accompanied with a 2 or more of the following, such as severe headache, retroorbital pain, myalgia, arthralgia, transient macular and maculopapular rash, like the picture on the right. So that's the rash looks like. So the rash will be typically on the face, thorax, abdomen, extremities, may not be associated with pruritus. So the patient will also presented with minor hemorrhagic manifestation such as petechiae, ecchymosis, purpura, epistaxis, and when we do tourniquet test, the result will be positive. And facial flushing or erythema and injected oropharynx, later I will show the picture, also because of minor hemorrhagic manifestation. And the GI symptoms such as anorexia, nausea, vomiting, abdominal pain, and diarrhea, and respiratory symptoms, also the patient can have the symptoms. But like I said, the children is usually asymptomatic or minimally symptomatic, meaning that not all patients will present with all these typical symptoms of dengue virus infection. So this picture here shows the hemorrhagic manifestation. So the picture on the left shows the hemorrhagic manifestation at the thigh. The upper right showing the facial flushing or erythema, and the bottom right it shows injected oropharynx. So this is what it looks like when we do tourniquet test. So when the result, there is a presence of 10 or more new petechiae in 1 square inch area, this considered as positive tourniquet test, like this picture here shows us.
How many?
So 10 or more per one.
Must bear what? You must define the circle.
Yes. 10 or more new petechiae in 1 square inch.
Okay. 1 square inch, which equal to 5 centimeter, or how much?
Not sure.
You must make it simple to your colleague. Make it simple and return back. It is very clear in the box. Okay. Yes, you
Okay.
need to correct and put more details. Okay. Continue.
Okay, later I'll find out and share with the others.
Okay.
Okay. Okay, this is just the repetition. So living in a dengue endemic area, present with fever and 2 of the following symptoms, such as the one that listed, as typically we suspect dengue. And also when the patient come to us, we need to also observe the signs that indicates warning signs. So because we afraid that the patient is currently in a critical phase of dengue. So the warning signs are as follows. The patient have abdominal pain or tenderness, persistent vomiting, which means 3 or more episodes of vomiting within 24 hours. So like our patient in the day 1, she vomit 5 times within 24 hours, right? And also abdominal pain she has. So we suspect, so that's why we classify the patient under dengue with severe warning signs, so dengue with warning signs. And also the other signs include clinical fluid accumulation, mucosal bleed, lethargy, liver enlargement, and laboratory finding shows increasing hematocrit and also rapid decrease in platelet count. So this is just the repetition. So when we look at the severe dengue, there are actually 3 components that we need to remember. What happened is that there is severe plasma leakage, severe hemorrhage, and severe organ involvement. So so the sign and symptom will be consistent with these components. So in severe plasma leakage, the patient can develop into shock, fluid accumulation, severe bleeding, and severe organ involvement, mainly because of the severe hypoperfusion rather than the direct viral infection to the organ. So this is just the same. Critical phase is just the same, the symptom with warning sign that I mentioned just now, because of the 3 components just now. Severe plasma leakage, severe hemorrhage, and also severe organ involvement because of hypoperfusion. So we can observe these symptoms such as because of severe plasma leakage, there is ascites, pleural effusion, liver enlargement, and severe abdominal pain because of severe organ involvement, persistent vomiting, mucosal bleed, and also lethargy. Usually, like I mentioned, not all patients with febrile phase will progress to critical phase. Most of the patient will just febrile phase and then directly recovery. But small percentage, when she or he develop critical phase, but most of them like febrile phase, critical phase, and then recovery phase. But like small percentage of patient will eventually develop into severe disease during critical phase. So that's why we need to manage early and intervene early. And in recovery, if the patient that goes into recovery phase, we can see there is improvement in the condition of patient. So the plasma leakage and the hemorrhage will resolve. The vital sign will stabilize. If there is accumulated fluids, they will be resolved. And then we can see a second rash, or known as convalescent rash. So the characteristic of the rash is like, we call it as a island of white in the sea of red. So we can see like a small patch, like a few patches of whitish in a rash and in the red rash. So this is characteristic of the second rash in recovery phase, and the patient will usually become severe fatigue. So this is the picture again of the convalescent rash. So remember, the island of white in the sea of red. So this is just to recap. So what are the characteristics of the febrile phase of dengue? Anyone? Quickly, just to recap quickly. There is anyone? No? Okay. Okay, I will just answer it. So remember, so the answer is symptoms that can resemble influenza, leptospirosis, and other acute febrile illness. Remember, I said pleural effusion, ascites, and clinical significant hemorrhage are the characteristic of warning signs in severe dengue, which are the components of pleural effusion and ascites are severe plasma leakage, clinical significant hemorrhage, and also severe organ involvement. So the other three is the sign of warning signs. So the next question, which are the following warning signs for severe dengue? Quickly, anyone can answer this?
Severe abdominal pain, mucosal bleeding, and persistent vomiting.
Okay, very good. Because the other three, when we look at confluent erythematous rash with small areas of uninfected skin, are characteristic of febrile phase. Myalgia arthralgia also febrile phase, and retroorbital pain with severe headache are also febrile phase. But severe abdominal mucosal bleeding and persistent vomiting are the warning signs of dengue. So the diagnosis, again, relevant epidemiologic exposure to the dengue-prone area, and also a clinical manifestation that's consistent with dengue viral infection. So we need to suspect dengue. And then this is the picture of the dengue combo test that Putri mentioned just now. So what we do is we detect the NS1, which is the dengue virus antigen, and also the IgM and IgG, the antibody towards the antigen, the dengue virus. So the most right picture showing this one that I mentioned just now, how we can detect the virus is very high specific and most sensitive, because we can detect as early as the onset of symptoms. Meanwhile, IgM and IgG, it may take a bit while.
At the fifth day.
Yes, doctor?
Usually at the fifth day and more.
Oh, okay, fifth day and more. Especially IgG, it appear a bit later than the IgM. Okay. So differential diagnosis. So when the patient comes with fever and then symptoms such as arthralgia, myalgia, headache, nausea, vomiting, there are actually few differential diagnoses that we can think of. So which are chikungunya, Zika virus, acute gastroenteritis, malaria, leptospirosis, parvovirus B19, and other viral hemorrhagic fever. Chikungunya and Zika virus, they are transmitted with the same vector as dengue actually. But the thing, so when we look at the table below, Zika and chikungunya, the patient usually manifest this few like distinctive feature of those two viruses. So when for Zika, yes, the patient can present with the non-specific symptom with that same with dengue, such as fever, rash, conjunctivitis, arthralgia, myalgia, and so on. But in Zika, compared to dengue and chikungunya, usually a patient present with prominent conjunctivitis. So you can see that it takes like two at plus at the Zika. For chikungunya, aside from the non-specific symptom like Zika and dengue, usually the patient will present with polyarthralgia, which is very prominent in chikungunya. The involvement of joint pain, which is more than 10. Yeah, more than 10. They are usually bilateral and symmetrical. Later, I will show the picture. So that's where we can differentiate between these three, although they are transmitted with the same vector.
But take care that conjunctivitis also occur with lepto.
Yeah, leptospirosis.
Okay.
Yeah, leptospirosis. But again, with leptospirosis, the point that we can support is a recent water activities, and then we will need to look at the history.
Yeah. Okay.
So this is the chikungunya. Like I said, there is a involvement of polyarthralgia, more than 10 joints, and then the characteristic usually it is bilateral and symmetrical. So the rash is like that for chikungunya. For leptospirosis,
sorry, again, for chikungunya, you must take care that it is some sort of reactive arthritis.
reactive arthritis.
Yes, it is not
Ah.
not true septic arthritis like that. It is just reactive arthritis. So it need high index of suspicious. Okay.
Oh, okay. Also, doctor, when we do radiologic imaging study, we can see the inflammation, right, doctor? Inflammation from the
Really, I don't have enough. I didn't see any chikungunya before to tell you. Okay.
Okay. Okay. For leptospirosis, yes, conjunctival suffusion is very prominent. We can see the patient. So again, we need to take a look at the history. Is it consistent with leptospirosis, such as recent water activities or any contamination of the things like soft drink can that can support the diagnosis of leptospirosis. So parvovirus B19, for this disease, it is actually, we need to take a look at the epidemiology exposure. In Malaysia, it is not very common, I think, when I read. And yeah, if we still want to take a look at this parvovirus B19, so aside from the non-specific symptoms such as in dengue, so the typical manifestation will be, so after first fever and 2 or 5 days after fever, normally the patient will develop this kind of virus, which is a slap cheek rash. So the virus will first start at the cheek, and then few days after that, then the rash um, will be present at the trunk and extremities. So that's a typical manifestation of parvovirus B19 compared to other disease. It is very discontinuous.
Yeah, this slide are very important. The slab cheek, if you see him once, you will not forget. And you must be able to answer why it's known as fifth disease. So what is the previous 4? And what is the 6? You need to add it, please. What is the previous 1, 2, 3, 4? And what is the 6 and the 7? Okay. Please answer it and put also. It is very important to know that parvovirus B19 has its own characteristic. It can cause acute hemolytic crisis in patient with chronic hemolytic anemia. We have a lot of cases of chronic hemolytic anemia. So if it came, sometimes it causes severe hemolysis or even a plastic crisis. Okay.
Is it common in Malaysia?
We will put it in its sequence. I don't know the infection rate here in Malaysia, but we used to see it in Middle East.
Okay. All right.
Usually it may come with the baby and the mother on the same time. It can affect eldest one. So sometimes there is a famous picture in previous, I think, Nelson, that mother and the baby can, both of them can get the infection. It is not limited to the young age.
Okay. Thank you, doctor. Okay, I think that's all for me.
Okay. Okay. So needs now to keep in view the differential diagnosis. Number 1, we are not accepting a single diagnosis. We must know what may be the other differential. The most important point is our ability to put a full diagnosis. Now, Putri, your patient now has a dengue fever, at which phase you must answer, and you must answer at the severity of the disease. Is it simple or warning sign? So what's your final diagnosis now?
I don't think that is severe, doctor.
Okay, so it is at which stage now? How many days of the disease?
Today, she went in on the 4th day, so I believe it's still in a febrile phase.
Say, so you must say it is dengue in febrile stage with warning sign.
Okay,
It will be a complete answer.
okay. So is dengue on febrile state, febrile phase with warning signs?
Yes.
That is the complete
Yes.
Okay.
Yes. Because even with yourself, you must know, because every one of this has its impact in your management. I mean, which is the most dangerous time which the patient can deteriorate. You must able to answer also. Okay, which we speak here, when he can deteriorate to shock or like that, must know the timing, the most critical one. So warning sign, you must know how is your protocol for management and observation and monitoring. That's my point. Okay, be alert please. If you have one patient in your on-call time, don't sleep and leave it. Must be very cautious.
Okay.
Okay, do you still have another slides?
Yeah, another presenter. And then,
Okay, how long? 5 minutes only?
not sure. Isa, are you there?
Yes, doctor.
Just
Uh,
5 minutes?
You need me to present 5 minutes?
Yes, please. The thing which you can, your colleague can do it, read it, they can read. And at the end, you must make the all points which we discuss around, and you send me the presentation, okay?
Okay, then I'll summarize the important points for you.
Okay.
Okay, but first, before I start, my internet connection is quite unstable, so please tell me if you guys can hear me. Okay, Bismillahirrahmanirrahim. My name is Nuriza Zahira binti Zamri, and today I'll present. The first one is regarding the complications of the dengue. Okay, next. Okay, so dengue actually has a lot of complications, but I focus on the two major classifications or stages of dengue. So the first one is actually the dengue hemorrhagic fever. So dengue hemorrhagic feature, the cardinal feature of this is actually the plasma leakage due to increased vascular permeability and also by hemoconservation. So by requirement, DHF requires all four following criteria to be considered as dengue hemorrhagic fevers. The first one is the positive test. The second one is this first one is the fever of acute that lasting about 2 to 7 days. The second one is the hemorrhagic tendencies, and for example, like the positive and negative test that has been shown by Afi before. And the third one is evidence of plasma leakage. For example, the pulmonary edema. Okay, the next one is the uh, put you next. Okay, the next one is dengue shock syndrome. So dengue shock syndrome is actually the complication of the HF or the progressive failure of the HF that leads to severe collapse or shock. So this is to
We can't hear you, Isa. Hello?
must be fulfilled plus the evidence of okay, where was I? Okay, so this is the both that I explained before is actually the DHF and DSS is the major complications of or stages of dengue, but there are also other complications such as the dengue encephalitis. There are also complications of renal if the patients have a shock and affects the secondary symptom. There are also complications towards the hepatitis or the liver, the hepatitis question, and there are also complications of cytokine storm, which all will not be explained here, but I can give you my references later. Okay, the next one. The next one is investigation done. So next, so this is like the four most common investigations in managing the patients with dengue. Dengue. The first one is the full blood count. So from full blood count in dengue, the most important, I think maybe that we see is the hematocrit because dengue patients actually present with dehydrations. We also can look towards the platelet, such as in the patients that so dengue will affect the platelet number, and most of them will have the thrombocytopenia, and dengue patients will also have the leukopenia systems or reduce of white blood cells. The second one is a renal profile. So the purpose of renal is to assess the renal function and electrolyte imbalance. So if the patients progresses to shock, it may impede the circulatory symptoms, and it may it may impede or reduces the circulation to the renal. So the renal system might be impacted. So we need to monitor the patient's renal profile regularly, as well as the liver function tests. So for liver function tests, as what I know, that the patients who have DHF or DSS has liver function test abnormalities. For example, AST and LD may be marked up as compared to patients who have dengue fever without warning signs, for example.
Is that
The last, yes,
is
doctor.
the full blood count? It is very important to comment about, as your colleagues speak about hematocrit
Yes,
and
doctor.
thrombocytopenia, which is the top important. Hematocrit, usually in dengue, we'll find the patient has increased hematocrit and the thrombocytopenia, which sometimes you need to repeat it every shift, maybe after 6 hours, to make sure is it dropping or not, as I told you. So you
Yes,
must
doctor.
include these two parameters, which are very, very vital for the patient with dengue. Okay?
Okay, doctor.
Okay.
Okay. For other than that, the mentions that we need to always check the hematocrit and thrombocytopenia. We also must regularly check them as we go on with the treatment, because it determines how much fluid that we should give to the patients itself too. And the last one is the dengue NS1 antigen. So that is being used on this patient is only the combo test, such as the dengue NS1 antigen test, and also the IgG and IgM test. Okay, next one. Next. Okay, next one is the management. So the management is the classifications of patients, and we can classify the patients according to, first one is dengue without some warning signs. The second one is dengue with warning signs, and the third one is a severe dengue, or if the dengue proceed with shock. Okay, so basically in dengue management, the management is only symptomatic management. We don't have a cure. So the management, firstly, patients where we usually give acetaminophen or paracetamol, and we avoid giving them aspirin or any NSAIDs for, so that the patient's hemorrhagic tendencies will not be worse. Okay, the next. And the next one is the replacement of plasma losses, which is the major part of the management of the patients. So the plasma leakage should be managed with intravascular infusion. So for example, in mild cases, or the patients does not need to be warded, or patients without warning signs, we can use the oral rehydration salt, and then we can discharge patients. But if it's patients with warning signs, or if we have patients with severe dehydration, we can administer intravenous fluid in with established intravascular volume vessels. But the plasmalysis is really judicious. So yeah, the plasma leakage, but level should always be checked. And okay, for the next one, I always. So and if the patients have shock, so the main management is still to repair the hemodynamic instabilities, and to give patient the fluid therapy. But reverse the stroke, if reverse, the fluid therapy should be tapered down slowly. Okay, And if the patient has shock offers close clinical observation, need to be done after restoration of normovillia. And IV fluid should be discontinued following the period of increased vascular permeability. So as shocks is reversed, the IV fluid will be tapered down. And in shock, besides monitoring of the hematocrit and thrombocytopenia, we can also monitor the patient's heart by using echocardiography. Okay, the next one. And the last one, in case of the bleeding, so the most common bleeding, maybe in mucosal bleeding, may happens because of the thrombocytopenia. GIT bleeding also may occurs because of the thrombocytopenia. So in case of the severe bleeding, which determines by the physician themselves, so blood transfusion can be performed for 5 milliliter uh, per kg of packed red blood cells or 10 milliliter per kg of whole blood in children. And in this case, that platelet transfusion is not effective as compared to packed red blood cells or whole blood, but may be warranted in patients with severe thrombocytopenia. And in case of the patient with hepatitis, we can administer, or patient with lack of vitamin K, we can administer intravenous vitamin K that help for severe liver dysfunction or prolonged proton time. Okay, then next. Okay, I think that's all from me. Thank you.
Doctor, we have prepared some OSCE questions. Would you like to go through it or would you like to end it there?
How many slides of your OSCE?
About 5 questions, if I'm not mistaken, by Afika.
You can study this OSCE together, but let me go to your, if you have any points to declare or any questions, let me answer it. And please, you must revise your all your information with last edition of our pediatric protocol, which is an important resource because Malaysia are the one of the country who has a very good management of dengue and the less mortality and morbidity. Any point do you need to ask about? Okay, go for question one. Who can answer rapidly? What is this picture? What is the name?
What?
It is the island of White in the Sea of Red.
Very good. Next picture.
Sorry, doctor.
No,
I have the
you will study it together, but let me see the next picture, please. The 5 pictures rapidly.
The next question, is it, Doctor?
Yes.
sorry, doctor. We can't hear you.
Next question. You must know the warning sign as your name from 1 to 7. Okay. The next one. Okay. The third question. Okay, for the okay, so now it put you now about the stage. It is 4 days now, so you must answer what stage. and what is the severity. Okay, the fourth question. Yeah. So this is an important. What is the name of this test?
Tourniquet test.
Okay, it is the same like his test or different? Okay, the last slide. Yes, yes. A finding of 10 or more BTK in 1 square inch. I mean here, it will be like 5 centimeter by centimeter. Okay. 5 centimeter by 5 centimeter, it is a cycle by around 5 centimeter. Okay, next. Okay, thank you for that. You did a good job, but the most important is to please conclude the benefit of our meeting today about one of the most common disease which must be ruled out in any patient with fever by an important point of the history, especially fogging or which area and like that. And after that, what stage of the disease, and the third point, what is the complication, and keep in mind to got all differential diagnosis, please. Okay. Thank you for your nice presentation. Hoping inshallah we can meet again with another long case presentation as soon, inshallah. Or hoping I can see you, inshallah, in the world this coming week.
Inshallah.
Okay, thank you.
Thank you so much, Doctor, for your
You are
time.
welcome. You are welcome.
Thank
Assalamu
you,
alaikum.
Doctor.
Thank you, Doctor.
Waalaikumsalam warahmatullah.
Yes, who is the one who will be good marking it today? She is Botri?
Marking what, Doctor?
Okay, just I will send you the result. Okay, thank you.
Oh, okay.
Okay,
Thank you,
assalamu
Doctor.
alaikum.
Salam.